In vast majority of situations, colopuncture feels gentle, nurturing, and deeply relaxing. After all, colopuncture is application of colored light on the skin. Sometimes there could be what is called reactions, some unpleasant sensation or something doesn't feel quite right. And there are many explanations for it, and the simplest one probably is remember last time you couldn't quite fall asleep because as you were deeply relaxing and getting ready for your night sleep, you suddenly remember something that you have to do or something that is worrying you and you forgot to do, something along those lines. So reasons could be many, but bottom line is if something doesn't feel quite right, then you need to manage your reaction with Colourpuncture. There are several approaches to it, and it depends obviously on your level of expertise in Colourpuncture and other techniques you might or might not be proficient at. So let's start with something very, very simple. The general rule and the first step is if something doesn't feel right, you stop the point where which you are treating and you move to the next point in the same protocol. And this is something that is indicated on Colourpuncture textbooks, and this is something that you're probably familiar with. And if you are just starting with Colourpuncture, this is probably most advisable thing to do because this is more straightforward. So this is the first step. So stop treating the point you're treating. If there is any unpleasant sensation, something doesn't feel quite right, move to the next point. So number two is reduce the time, because usually with Colourpuncture we apply light for anything from 30 seconds, 20 seconds to 1 minute, sometimes more, depending on the situation, depending if this is a body treatment or this is a different kind of treatment, more mental therapies, or soul spirit therapies. We're talking about conflict resolution, this kind of stuff. So reduce the time. This is especially true if your patient is highly reactive, or this is somebody who is elderly, somebody who is somehow fragile, or the patient could be very young. For small children, we do less time per point. So instead of 60 seconds, do 30 seconds or 20 seconds, even 10. Instead of, as for the lines and zones, instead of 5 zones, for example, 5 lines, I'm sorry, in prenatal therapy, do 3 lines. So you started your prenatals, you plant 5 as per protocol, but you feel that this is too much, patient is not comfortable, they're not relaxing deeply, something is not quite right, or they can voice it out. So you do 3 lines instead, and then you carry on with doing 3 lines on each other lines, depending on where reaction happened. So zones, same thing. You either do less zones than you planned, or you do less time per zone. We are talking about reflexology zones, we are talking about dream zones. Very rarely will you have any reactions with dream zones, but sometimes it can happen. Again, something happens when you are deeply, deeply relaxing. Suddenly your body can start giving you some messages which can feel not even discomforting, but just somehow it disrupts the process of relaxation. So you need to remember something, you need to remind something. Very often your patient will just voice it out. Or very often if you're doing Colourpuncture as a self-care, obviously you will feel it. What you can do in this situation, you can simply stop your treatment, you go to your journal, you note down your reaction, and then you carry on with your treatment. This is the best because you get the insight and then you carry on with the treatment. So number 2 was reduce time per point, time per zone, time as many lines as you do. So reduce the amount of lines in your treatment. Number 3 is play with your colors. Playing with your colors is something that you will start doing as soon as you start working with Colourpuncture more seriously. There are several options here. The most obvious is you switch to complementary color. So for example, if you're doing endocrine treatment in blue and it doesn't feel right, you switch to orange and vice versa. And sometimes it's not quite intuitive. So for example, for many treatments for hyperactivity, and including hyperactivity of the heart energies, you will be indicated to treat it with blue. However, orange, complementary color to blue, is a very special color, is a special color for nurturing qualities and especially for the heart. So sometimes You find that you start treating with blue and something doesn't quite feel right. So you switch to orange, everything is perfect. You can then switch back to original color, or you can stay with the color that feels right. This is entirely up to you. So complementary color, this is one situation. Another situation could be is you switch to alternative color, because sometimes in your treatment protocol there will be indications that you can use this color instead of that. So, for example, for many degenerative treatments, which are supposed to improve blood circulation, peripheral flow, so you can start moving the stagnation, moving the stasis, red is indicated. However, you can switch to turquoise if there is a strong reaction, or vice versa. So many situations like that. When you're a bit more advanced and you are doing color puncture for quite a while, you can play with colors really. Sometimes you can do, for example, light green color for many situations when there is a need to manage reactions in general, including emotional reactions. And we are talking more in terms of elements. We are talking about wood, we are talking about liver gallbladder. So instead of yellow, which is a default color for liver gallbladder treatments, you can use a light green, because if you think about it, light green is a combination of yellow, so you're still giving yellow, which is very warm in color, and green, which is balancing color. So for some people, especially people who need, for example, detoxification, but at the same time, so your focus of your session is detoxification for physical reasons, but at the same time, they are also feeling very emotionally fragile. They're having lots of reactions and so on. So this is one example, and I'll expand on it later when I'll give you, in some further calls, an example of how I structure my sessions and which treatments I choose and so on. When we're talking about back segments, for example, when we're talking about back segments as a microsystem, because our back has projections and reflex zones for all the internal organs. And each organ obviously reacts best to a particular color or combination of colors, again, options or complementary colors. However, in certain situations, for most of the zones, you can use light green, especially crystal ball and light green. If you have a crystal ball, you absolutely use your usual light green. But if you have a crystal ball, then using it on your back segment is excellent, just because of quality of crystal ball as well. So this is because of specific quality of light green. Also, what you can do, again, if you are familiar with Colourpuncture a little bit more, you can do many points regardless of the initial indication, either in turquoise color, which is more color of the soul. Color of the soul is color of our perceptions, memories, feelings, associations. So this is more soul. Or rose, which is color of the spirit. Rose is a color of our very core, our deep spiritual blueprint, if you wish, our program, this kind of thing. So you can do it in rose or turquoise for many colors. Again, if you know what you're doing, this is slightly more advanced. So this was number 3, playing with colors. Number 4, you can increase gaps between your sessions. Quite simply, when we do, for example, some structured protocols such as prenatals, mother-father balance, transmitter relays, conflict resolution, we usually structure them proactively in advance in a certain manner. For example, we don't do them every day or even every other day. Usually prenatals and mother-father and transmitter relays, we structure in a way that it's either a couple of times a week maximum or once a week. So there are certain rules, there are certain, not rules, guidelines more. With conflict resolution, the one on the head called small conflict resolution for energetics, you can do it every day, or you can do it up to 3 times a day in certain situations of degenerative diseases. However, if that feels too much, then you can increase gaps between your sessions. Why is that? Again, this is a subject of a separate talk, but this is mainly to do with how our brain, our mind, processes and integrates changes in our perception, because this is what happens with our conflict resolution therapies. When we do conflict resolution therapies, suddenly we start seeing events or our life experience in completely different, or ourselves in a completely different way. And these changes in perception needs to be given time to get integrated. We are almost start seeing like 3D instead of 2D, and color instead of black and white as we saw our experience before. So this is what conflict resolutions therapies, obviously they're amazing gift of color puncture, but sometimes you do need just extra time or maybe extra body session in between. But here we are mainly talking about your regular color puncture session, which is not structured. So this is generally the rule. So number 4 was increase the gap between the sessions. And number five is more about how we finish the session. How we finish the session if there was some kind of reaction within the session. And generally, when we are talking about people who react, so people who react with some kind of excessive reaction, we are paying attention more to this finishing touch, how we complete the session, rather than our opening treatment, which we use more for patients who are slow to react, difficult to react. And so they have difficulties connecting with their body. So then we are paying more attention to opening treatments, introductory treatments, so to speak. And then we are talking about polarity treatments, laterality treatments, information barrier types of treatments, ear shadow, ear topography, this kind of thing. So this is for people who do not react or they have difficulties connecting with their body. For in our situation, what we are talking about, some excess reaction, we are talking more about how we finish the session. There are several options. Colourpuncture wise, we can use ellipses, and this is a classic. This is indication because ellipses help the person to integrate then a particular issue or particular site that they start seeing, or it could be a body sensation like a little sort of spasm or some kind of a discomfort, and ellipse will resolve it most often than not. We're talking about different ellipses. There are many ellipses in Colourpuncture. If session doesn't feel complete in general, you've done everything, there was some sort of reaction, but something doesn't feel complete. You talked, you listen carefully to the person, you observe their body reactions, but there is no sort of final resolution as you feel. You can do ellipse of subconscious around C7 in turquoise color. This is beautiful. If there is any issue, classic indications, if you have any issues with mother, as mother, feminine energy, in energy, deep nurturing, childhood issues, first experiences, any body correspondences to that, then we can do mother ellipse. If there is any problem with self-expression, in acting in the external, acting proactively to what you know you need to do in the external, but for some reason it's not happening, or any issues with males, any father problems, then you do father ellipse. If, for example, there is a very sort of complex mixture of quite strong emotions and sensations, and situation is very, very complex and entangled, you can do ellipse of material existence. That again, it helps the person to connect deeper with their body, and from this connection, something can come. So this is ellipses in Colourpuncture. You can always finish your session with giving some dream zones with oil, relax. So resolution, full resolution can come in a dream, because sometimes for various reasons, some people are very slow to react. I'm speaking from experience here. When I just started Colourpuncture, reaction for me, any kind of reaction was like, oh my God, there's a reaction. I'm so lucky because I didn't react at all. I didn't feel my body. I didn't feel Colourpuncture. Now it all changed, but it took me quite some time. So if you apply oil relax, or they have their own oil relax on energetic zones, energetic dream zones, and resolution can come in a dream. And then you can ask to note down the dream and bring the dream to your next session so you can do some dream work on it. Beautiful. You can also do some crystals as well. So, for example, depending on the nature of the problem, you can do, if there is more emotional situation, you can do love disc, what is called love disc or disc of the heart. You can just apply it to positions which are indicated in your manual for the disc. More for body situations, you can do earth disc. For all the situations, including more feeling sensations, then you can do dream disc as dream disc, not dream zone, but dream disc as such. So you can use any of this. You can absolutely give them homework as well. Because very often, what reaction really is, reaction during Colourpuncture is some awareness. And some awareness of something that the patient or you, if you're doing self care, didn't notice before is just a call for action. So, what kind of action will be relevant to take? It can transpire your dreams, or you can do journaling. Journaling is excellent. Journaling prompts help. If you're not sure, ask me about journaling prompts. And one last thing here is that if you feel that your situation, either your situation, if this is self care, or your patient situation, more or less clear, but something is not quite happening in terms of either full acceptance or almost something is hidden. What you can do, especially with patients, if you feel like the situation is really clear for you, so their diagnosis, their test results, their reactions, the treatments you choose is speaking in just one big overarching theme, but the person is not connecting to it, you can follow up with ellipse of perception. Ellipse of perception is excellent. This is such a magic tool in Colourpuncture because sometimes we just do not feel, we do not see what is there. Even it could be absolutely obvious for everyone else. So ellipse of perception in turquoise or light turquoise is another excellent tool. Hope this helps. I just a summary. So if there is a reaction, first you can move on. You can stop the point you're treating and move on. Second, you can reduce the time per point, per line, per zone. Third, you can play with the color, switch into complementary or alternative options, or some more generic options, such as in case of light green or rose or turquoise because of color qualities. And number four is increase the gap between the sessions, for example. And number five is really paying attention to the finishing touch. Above all, listen and observe body reactions of your patient and your own if you're doing it for self-care, because this will show you the way for future treatments. So good luck with your Colourpuncture experience, with your Colourpuncture treatment. Any questions, please let me know. I'm here. And I would like you to really, after you finish watching this, I would like you to really sit down with a pen and paper and reflect a little bit what, from what I said, sort of made some sense to you. Maybe recall your most recent experience with Colourpuncture, treating somebody. What could you have done differently? Or indeed, if you did something along those lines, fantastic, then you did really great. Of what is your plan, what you can do better next time to make your Colourpuncture experience or your client's experience the most complete, the most insightful, the most comfortable, and just rounded, soft and deeply nurturing. Ask me questions. On a practical level, I'm going to plan several lives during this month or next month, and I'm going to introduce topics in advance. So please subscribe to the channel and you will be notified in advance so you can plan your time and you can plan your Colourpuncture questions.